The twin study.
So there was actually a really interesting study of a set of identical twins. And I can't recall offhand whether they were in their 40s when the study was done or 50s. But one had actually gotten Botox fairly early on and fairly consistently over the course of a number of years. And the other one had not. And the pictures of the one that had gotten Botox versus the one that did not was pretty astounding, the difference. The one that had not really didn't have very many wrinkles because Botox and Xeomin and all the neuromodulators are all preventative as well. And that's why people tend to be getting them younger. They don't need as many units, they don't need to do it as often, but it tends to be preventative. And so this twin that had gotten the neuromodulator over the course of a time period versus the other one, the difference in their faces were actually very astounding. You can look up the study.
So how early then would you recommend that a person might start taking, doing treatments if they were trying to be preventative?
So it really depends on the person and what they're seeing. There's some people very early on that they start seeing, the wrinkles in between. Once the wrinkles are permanent, we can't do anything about it. We might be able to soften them a bit, but we really can't do much about it. So, for instance, there are people very young that get their really tight banding very early. We can actually do a lot on the banding because what happens is that muscle, when it's banding, is pulling down your chin and it's pulling down the platysma, all the muscle here, which is causing these jowls that I have right here. Had I gotten the Botox on my banding very early on, it's very possible I wouldn't have it, and the people that have it would have less of it. Same thing with the DAO injections, that also plays into that same area. So it really depends. If you're someone who's already seeing some 11s between your eyes, take a look, and you can probably, I'd say mid-20s, or what I'm seeing from my daughter is saying that her friend's in the mid-20s. I'd say by 30s, you really should be starting to do just a little bit of preventative care, bare minimum. 20s is a little controversial. If you definitely see that there's a difference that you want to prevent, then do it.
Awesome. Do you use a lot less when you're doing it preventatively, or is it the same?
Oh no, it's a lot less. It's a lot less. They need a fraction of what you need because you don't need much to freeze the muscle if it's barely there.
Right. Okay.
So.
Thanks.